Alright guys, what is up? Welcome back to the channel. In today's video, we are going to go over specialties that I would pick if I could not do ophthalmology. What is up guys, and welcome back to the channel. I'm Zach with Dr. Eyeball MD. It's good to have you back. If you're new, I'm a first-year ASOPR's Oculoplastic Surgery Fellow. So that means I do plastic surgery around the eye, on the eyelids, in the eye socket for orbital tumors and cancers. I do cosmetic eyelid surgery. So that is what an oculoplastic surgeon does. I'll be making a video detailing exactly all the cool things that we do in a later video. But in today's video, we're gonna do a fun one. We're gonna talk about some of the things that I would probably do as a physician in terms of specialty if I couldn't do ophthalmology. So first of all, would I do ophthalmology again if I had to choose? Yes, I would do it again if I were picking a medical specialty again. I think it's one of like the gems in medicine, ophthalmology is, just because it checks all the boxes. It lets you be a specialist, it lets you do surgery. I get to sit down during surgery. They're not long surgeries most of the time. It's fun surgeries, they're happy patients. You know, you make good money doing it. You know, it's a chill, laid-back specialty by and large. It's not like cutthroat, die-hard general surgery stuff. It's really nice. The lifestyle is good. The call is good. I don't have to spend a lot of time in a hospital rounding. It's a gem in medicine, guys. If you don't believe me, subscribe to the channel and I will show you that is the case. But so that is, to get that out of the way, yes, I would do it again in a heartbeat. It's a lot of fun. I love the surgery, so yes. But if I couldn't do ophthalmology again, what would I pick? And this actually was kind of the question that I had in medical school when I was trying to decide if I basically wanted to do ophthalmology, because I was down to a few different things. There were like 2 or 3 specialties, probably 3 specialties that I was considering doing pretty strongly, and then I ultimately ended up picking ophthalmology. So what were those other specialties that I were considering at that time, and what would I pick now? So at the time, the other specialties that I was considering was oral maxillofacial surgery. I was very close to applying for that because the medical school I went to was one of the few places in the United States where you could go from medical school into an OMFS residency directly. I think maybe like 1 of 2 places at the time. So I did medical school in Alabama, and my medical school there, UAB, University of Alabama at Birmingham, it's a really good medical school, by the way. The oral maxillofacial surgery program at that medical school would take medical students. So you could finish medical school, you could do, I think it was like the latter half, like 75% of dental school, and then 3 years of oral maxillofacial surgery residency. And when I told people this, they were like, "You're crazy, why would you want to do that much training after medical school?" So in the end, it would have been 7 years after medical school. And as it is now, an oculoplastic surgery fellowship, once I finish, I'll have done 6 years. So the difference is pretty small. It's a year difference. So it's not that different really, unless I went on to do like a fellowship in OMFS. But so I was considering that really strongly. I met with the OMFS like program directors. I interviewed with them. I did a lot of shadowing in OMFS in medical school. That was really high on my list of things I was considering. For some reason, I just wanted to like operate on people's faces, and I don't know why. It's funny how it came full circle with oculoplastic surgery. So OMFS was high up there. Plastic surgery, I looked into plastic surgery. I met with the plastic surgery program directors at my med school. I was considering that pretty strongly. I wasn't too interested in like doing plastic surgery on the rest of the body. I thought if I did plastic surgery, I would want to do facial plastic surgery. Again, I don't know the reason that was attractive to me, but it was. I think there was something about like just giving patients like, you know, a good outcome cosmetically, and something that they have to like show to the rest of the world, and making them, you know, presentable in that way. Like that was appealing to me, I think. And so I looked into plastic surgery for that reason. The other specialty I was looking at in medical school was ENT. And again, for the same reason. I wanted to do the facial fellowship after ENT, or I wanted to specialize in like facial cosmetic surgery and reconstructive surgery if I did ENT. And so I was looking at ENT. Outside of that, I wasn't really interested in internal medicine. The rounding killed me. I just like couldn't do it. It was just too much like pontificating and just like thinking, like long-winded thinking and stuff. It wasn't for me. I didn't like psychiatry. I really didn't like OB-GYN. That really grossed me out, I'm sorry. I did not like that. I did like neurology, actually. I really liked neurology. The whole like neurologic system is just like a big circuit board, and for whatever reason that really clicked with me. So like localizing lesions was like something that seemed to come naturally in medical school, and I understood all that really well, and I got really good at the neurologic exam. But like the fact there were no procedures and no surgery in it like was kind of a turnoff. But then I was like kind of interested in neurosurgery very early on in medical school for that reason, because like the whole like seeing it as like an electrical circuit and then like adding surgery into it was appealing. But then I like saw what neurosurgery residents and like people that did neurosurgery in the hospital kind of looked like, and like the vibe wasn't good. They just didn't seem that happy. The work-life balance was just too off base. Like it just wasn't good, you know? So it wasn't the route that I wanted to go down. That's kind of how I approached some of those specialties. So that's what I was considering in medical school. Now, if I had to do it again now, having done what I've done and knowing what I know now, specialties that I would pick, it's pretty much similarly in line. I think I probably would be less interested in ENT. I find that less interesting now than I did in medical school. Going through that route to get to like facial cosmetic surgery or facial reconstructive surgery, I wouldn't go the ENT route. I may still go the plastics route if they'd have me, you know. If I had to do it again, I would definitely still pick ophthalmology. OMFS, I would do OMFS still. I really think that's a cool field, a cool specialty. So I would pick OMFS if I had to choose something now. So let's rank order it, you know, because people like lists. So if I couldn't do ophthalmology again, I would probably go for, I think OMFS would be my next pick. Next would be plastic surgery if I could get into it. The next thing I would probably pick would be, it would definitely still be like a surgical subspecialty. I don't know what it would be. Actually, you know what I might like would maybe be something like interventional radiology. It would have to be procedural, but I like kind of the radiology vibes and kind of just like they're in their own little world, but getting to do procedures. So interventional radiology I think would be pretty cool. If I didn't like care about work-life balance and like having any life outside of medicine, I think something like cardiothoracic surgery would be awesome. Or vascular surgery, probably vascular surgery. So OMFS, plastic surgery, interventional radiology, vascular surgery. It's probably the order I would pick. Vascular surgery because it kind of relates to microsurgery. I found microsurgery very appealing. I think that's part of the reason I picked ophthalmology. Like doing fine little work on little things. I don't know, I like that. So vascular surgery has that, anastomosing vessels and all. It feels like you're kind of like an artist in a way, I think, or I think it would. I've never done it, but I think that's kind of how it would feel. So that would probably be one thing I would pick as well. Fortunately, I don't have to choose again, and ophthalmology worked out, and then it dovetailed into oculoplastic surgery, which I'm really, really liking. Subscribe to the channel if you want to see my journey through that. But yeah, those are a few of the things that I would pick if I couldn't do an ophthalmology residency. Those are some of the fun ones, I think, or I think they would be fun. It all centers back to surgical subspecialties. I would have to work with my hands and do procedures. If I had to pick a specialty that were not surgical, I probably just wouldn't do medicine, to be honest with you, but it would probably be something like pathology, where I could just sit there, hang out by myself, look at little slides, play music. I'm not trying to give any reductionist view of pathology. I think it's a really cool field, and I actually thought it was pretty appealing in medical school too. I just wanted to do something procedural, but if I couldn't do something procedural, it'd probably be pathology. I hope that was entertaining. I'm sure it was not at all educational or informative, but maybe it was entertaining. Hope you guys liked it. If you did, leave a like on the video, subscribe to the channel. I'm Zach with Dr. Eyeball MD. Leave me your comments down below on what you would have picked if you couldn't have done your specialty, or what you're thinking about picking if you're going into medicine. So I'll see you guys in the next one.